So, for a long time now, people have been asking, when is that vaccination going to be available for the younger kids? So we're talking about 6 months, to 5 years old. And now it looks like it could happen by the end of this month, Dr. Sagar.
This is very promising news for many of us who are parents, aunts, and uncles, and grandparents, hoping that our youngest can be protected. So, as an aunt myself, with a niece under the age of 5, it's very exciting. And, the studies are supporting, and early data is showing promising results. So, we're looking forward to it.
Now, we know Moderna got that full approval. And, I think earlier days of the pandemic, a lot of people said, well, it's only emergency use. It doesn't have full approval. But does that full approval really move the needle when it comes to people making the decision whether or not to get vaccinated?
I think it certainly helps because now we can tell them there is ample data. We have now studied it for over a year, and we can say for sure that it is safe, it is effective, especially when we think about saving people from ICU stays, being on ventilators, and even dying from COVID. It's been shown to be very effective, and this is now the full approval makes it easier for folks to feel confident in taking the vaccine.
I was taking a look at your Twitter. I look at it probably every day. And one of the things that you wrote was to change the course. In year 3, if we want to change the COVID trajectory, we must focus on the ambulatory world. So what does that mean?
Sure. So first of all, let's define ambulatory. Ambulatory means outside of the hospital. So that means our doctor's offices, our nursing homes, our rehabs, our surgery centers, even urgent care centers. And the reason it's really important is because now we're seeing that while ICU care is really important and there are patients in the ICU and in our hospitals across the nation, that is just the tip of the iceberg. Majority of the people are really staying at home, and that's what we want. They're safe, they're recovering well because they're vaccinated and boosted, and they're staying at home. But we really do need to help our ambulatory clinicians and staff manage this. So we do need resources such as providing coordination of care. That means having navigators to call and check in on patients, making it easier to access vaccines as well as other treatments that are now available that our doctors and our nurses can help our patients access.